Shoes for diabetes, and what shoes do we use in the podiatry clinic to help to treat a patient with diabetes? Firstly, it helps to understand a little bit what diabetes does to your foot. So when a patient has diabetes, they have uncontrolled raising and lowering of their blood sugar. Now, the raising of the blood sugar, very briefly, is poisonous and damages the blood vessels and the nerves in their feet. So they have a foot that's less likely to feel an injury and less likely to heal from an injury. So this sets up a situation where you have a patient that's got a foot that's more likely to be injured and more likely to become infected, and that's why diabetics have a much greater chance of amputation than the general population. So knowing this, that a diabetic foot's more likely to become injured and amputated and infected, it makes more sense that we understand then, okay, if we have a shoe that is less likely to injure the patient's foot, then it's a good shoe for a diabetic. So the shoes that we use, this is the InStride AeroStride, it's a men's shoe. So some of the features of this shoe are specifically for diabetes. Now, they need to have all the other features of a good shoe, like where does it bend, it shouldn't twist too much, and it should be fastened to the foot. But the specific diabetes features are that they've got blind seams so that none of the stitching will stick out and irritate the foot. It's neoprene lined, so it's got this really nice neoprene forefoot section, so that if there's any bony prominences or anything sticks out of the shoe, you can see my finger there basically sticking right out. If you've got any clawing of the toes, it's less likely to irritate the dorsal aspects of the toes, so they're less likely to get ulcers and irritation and blisters. The other great feature of this shoe is that it's got these linings in here. So it's got 1, 2, and if I can get it out, a third insole. And what this allows us to do is it allows us to adjust the depth of the shoe. So say, for example, yourself or a relative has very, very clawed toes. What we can do is adjust the height of the insole down so the toes don't actually touch the top of the shoe, and they're very much less likely to get irritated. The other great feature about this one is it's got the Velcro on and off mechanism, because quite often what we find as our patients become elderly, they get arthritis in their hands or they can't see very well. So this makes it very much easier to get the shoe on and off, as we prefer not to use a slip-on shoe, because a slip-on shoe will actually put more pressure to hold it onto the foot. So we prefer not to use a slip-on shoe in a diabetic patient, just because that can actually cause more irritation. So they're the main features. They're blind seam, they've got the adjustable depth, they've got the neoprene lining, and they've got this Velcro on and off attachment that helps make it very, very easy for the patients to get the shoe on and off. And that's the InStride AeroStride men's shoe. And you can find this at the Athlete's Foot, or you can find them online at ergonics.com.au. If you have any questions about a diabetic shoe or diabetes in general, we're happy to help out. You can ask your questions in the comments below. Thanks. If you enjoyed this video, please like, comment and subscribe. It's really simple to do, and it really does help out our channel. If you need more information on the topics discussed, you can find some links in the description where they'll take you to our website where we can discuss this in a little bit more detail. If you have a specific question that you'd like answered, please comment in the comment section below, and we'll do our best to make a video to address your question. Thank you all for watching, and we'll see you next time.